we play a lot. We blow bubbles and we sing and we turn cartwheels when we have, you know, good things happen up there. We just play a lot, and that's really important to me, and it always has been, because I think the kids are kids, whether they're sick, whether they're healthy, you know, whatever, they're still kids.
I think that when you're relating to a child, it's very important to focus on the child and see, as you walk in the room, that very first instant, how the interaction is going to play out. You'll see a child gripping mother and not wanting to even look at you. You'll see another child sitting in the corner playing. You have to really tailor your care to the child.
When children are scared or they're crying, I kind of like to pop into the room sometime and blow bubbles at them and just be the goofball, and they can't help but laugh sometimes, you know. And to me, that's the most fun, is just being the big goofball and getting down to their level and playing with them and, you know, truly understanding, you know, their development and where they're coming from.
My wife would tell me that I've never grown up, and then she would sit here in front of the camera and tell you the same thing. Again, I think that's the secret to taking care of kids, is to just never really forget that you're a child at heart.
You approach cautiously, you kind of talk to them from the doorway a little bit and talk to them about things that are happening in the room, or what are they watching on TV, what do they like to do. I ask them if they'd like to color, and I'll go get them a coloring book and crayons. You kind of have to approach them and get their trust before you do anything to them.
I try to joke around with them if I can. Sometimes even just little simple things that you learn in pediatric residency, like pretending you're looking for Elmo in their ear, or hidden things on them, or just trying to talk with them while I do a procedure, to ask them about their pets or their teacher, or things they like to do.
Oftentimes, actually, the kids are better than we think. Sometimes we think they're going to be embarrassed when they really aren't. Sometimes they are when you don't think they will. For the most part, just talking to them and actually being pretty objective with them.
And I think to get down at their level and make them understand that you understand by looking them in the eye, by embracing them and their fears, and telling them that it's going to be okay, is a great way to start.